From across Maryland, Virginia, and the District, this is Washington's 24-hour local news leader. News Channel 8's Live This Morning starts right now.
Head and neck cancers rarely get as much attention as, say, breast or skin cancer. But the good news is, with screening and early detection, cure rates can be 90% in some cases. Dr. Gupta joins us live this morning with more on how you can keep a closer eye on what's going on and what the warning signs to head and neck cancers are. Doctor, it's always a pleasure. Thank you for joining us.
Thank you.
This is something that probably doesn't get as much attention, but frankly we ought to be paying attention to as well, because it's something that's fairly close by. We're aware of it. If there are changes, they're pretty easy to identify. Let's talk about what the changes are. What should we be looking for first?
So, it's good that you're bringing attention to this, because again, it is a disease that doesn't really get a lot of attention. One of the biggest risk factors is smoking. So when we talk about symptoms, or what things you should be looking for is, if you are a smoker, you have persistent hoarseness, persistent sore throat, ringing in your ears, difficulty swallowing. All of those are something you need to bring to the attention of your physician, because those are classic signs and symptoms of head and neck cancer.
But if you don't necessarily have to be a smoker, though, to get head or neck cancer.
Well, we're starting to find out that no, you don't. I mean, the majority of them still are smoking and alcohol related,
yes,
by far. So let's not forget that. But yes, we are finding that actually the same virus that can cause cervical cancer can also cause cancers of the head and neck. So the patients who I see sometimes who don't smoke and don't drink, that's one of the things we've started to screen them for on their biopsies, is to see if they are a HPV or human papillomavirus carrier. Right now, having a virus doesn't change treatment in any way, but it does seem to show better prognosis than the people who smoke.
Interesting. Okay, let's talk a little bit about the treatment for these cancers, because if they are advanced, they can be, the treatments for them can be very difficult. They can be painful, lots of side effects. They can be disfiguring if surgery is involved.
And you're absolutely right about that. The role, I do a lot of head and neck cancer treatments, and the reason for that is the advantage to radiation treatments over surgery is that it's not as debilitating. Your organs and structures are still in place. That's not to say it's not without side effects. But yes, the surgery for head and neck cancers, I have a husband who's a head and neck surgeon actually, are pretty profound. I mean, losing your vocal cords, losing your ability to swallow. So we made huge strides and advances in what we call organ preservation with chemotherapy and radiation treatments. So yes, the treatments are there, the surgeries are there, but frankly, again, this goes back to what we've talked about before. If you don't smoke, you don't drink, you'll lower your risk of that, you'll lower your risk of lung cancer. You know, if you have any symptoms that you can't seem to get rid of, you need to see your physician. It's not to be ignored. It
is those chronic problems that are a real sign, and this is something that you do not want to delay. raddocs.com. Dr. Gupta has a website where there's lots of really good information there. I commend it to you. Thank you so much for joining us. It's always a pleasure. We're going to step away for just a bit at the top of the 10 o'clock hour. Back with more news. We hope you'll stay with us.